Dziękuję wam, że przyjęliście zaproszenie, ponieważ my, którzy już tutaj działamy, naprawdę niesiemy tą informację ze szczerego serca. Także jeżeli dzisiaj przyjęliście to zaproszenie od waszych przyjaciół, to zapewniam was, że oni naprawdę coś wartościowego chcą wam pokazać. Powiem wam szybciutko, jak ja dotarłam w to miejsce. Rok temu, w kwietniu, czyli ponad rok, kilka dni, znajdowałam się w sytuacji nie do pozazdroszczenia.
Now, a year and a day ago, I was in a very bad condition. I was depressed. I was completely empty in terms of my wallet. Well, you can imagine that wasn't something to envy about. But I prayed to God, take me with you. But you know, God was very merciful, and He sent me my guardian angel, or friend, Marco Boys, who lives in Spain. He asked me for a coffee. That was the 1st of May, more than a year ever since. And not only did he change my life, he saved my life literally. At the meeting, I found out about some opportunities to improve your life, just using some completely non-competitive products, because they are second to none in the world. They are unique across the world. So he told me about her daughter who suffered from asthma, who went to the hospital every couple of months, how those products help her over a month to move all the steroids, all the inhalation.
I w tym momencie zrozumiałam, że on mi pokazuje coś naprawdę wielkiego. I powiem wam szczerze, że poczułam nadzieję. On mi oddał nadzieję, że może coś w moim życiu się zmienić. I zdecydowałam się tego produktu po prostu spróbować. 2 tygodnie później osiągnęłam mój pierwszy sukces.
Later, that was my success. First success because I felt like I wanted to.
Który zdecydowałam się podzielić tym skarbem z osobami, które znam. Zadzwoniłam do Bobiego, mojego wielkiego przyjaciela od wielu, wielu lat, tutaj z Polski. Powiedziałam, Bobby, mam super suplement. A Bobby pokazuje mi stolik pełen takich pudełeczek, różnych takich, wiecie...
Of those tiny little boxes and check it out. I'm already on supplements. I say, yeah, I know. But no. Not what I have. Try this out. You just don't absorb your supplements. Who of you, is administered any supplements, tablets, pills, everybody, right? So I gotta tell you, we have the most expensive urine in the world. It just goes through us. It flushes out. Just use it to water your flowers, right? Now you don't absorb anything. What to do in order to absorb it better? Well, a year has passed. In Poland, there's about 30 to 100 people in Poland who enjoy their health and those opportunities, and that's why we decided to organize this meeting, just to let new people know, because we want to change their life as well. And on top of that, we have those fantastic visitors among us. We have the founder of the business, both Sebastian and Ryan. So once again, let's give it up to our visitors from the United States. We are truly unique. They didn't go to Spain. Well, it came to us. No, they chose Poland, actually.
Thank you.
Now I'd like to give the floor to a person who I met here on board. I don't know Dr. Marcin before. Whenever something valuable is there, valuable people join in. Marcin Sowiński is a natural therapist and a physician. I hadn't known his career till we met, but I was moved by his care. He really works with people on every level because he truly cares for their treatment, for making them better, not just sell them yet another syringe or yet another pill. He moved me by investing his heart, his passion into what he's been doing. I came to Poland last year and we did some seriously good job traveling around Poland, and each time we met, he proved me how much he cares about people. Now, I don't know the whole curriculum, so to speak, the whole agenda. So when we introduce it, he always has to help us. Okay, just 2 titles? 2 titles? Only 2? Please, let me do that. Let me do that, please. Okay, so He lectures at International Complementary Medicine Academy and the founder of BCG Clinics Limited. Yes, let's give it up to Marcin.
Witam serdecznie. Okej, ja będę mówił to, co mówiłem niedawno jeszcze
Good afternoon.
w Rzeszowie.
I'll be repeating what I said in Rzeszów some time ago. The lecture was broader. I was speaking to a room of 1,000 people, and there was huge interest. More than 200 people were interested in new products after that lecture. So it was welcomed, the lecture, but I will give a short version of my lecture today. Let's see if it works. Can I swap the slides easily?
Jest, dobra. Więc chodzi o detoksyfikację.
Okay, it's all about detoxification.
Jest nasza mentalno-emocjonalna
Our mental, emotional detoxification of what poisons us is the most important. If it's medication, if it's people, they say it's ill.
Mam taką osobę u siebie i mówi mi, że lekarze w Berlinie powiedzieli, że
I have a person who heard from that they're going to die because it's that's cancer again. It's back. And then I tell her for 5 minutes, please try and do this one thing. Say, keep repeating, I am healthy.
mam zdrowe komórki, mam
I have healthy cells. I have healthy tissues. And so I try to teach her how to detoxify her body and go to the positive side of thinking. And 3 months later, she returns to me, shaking her bag and screaming, I'm healthy. What did you do? What did you want me to do? What did you order me to do? She says. Who ordered me to think positively? So this is such a wonderful thing to change your way of thinking. Even if after such words you can enter a new zone, a healthy zone. It's a beautiful thing. So that's what I'm starting from, about detoxification of all the toxins. But we have 3 levels, 3 phases of detoxification are in the body, of toxin removal in the body. And the whole problem is that all those factors that are due to bad conditions of living, bad food. I know we're starting to deal with it. We'll have better food because it all leads to cancer, to obesity, vascular diseases, diabetes, neurodegenerative diseases, such diseases as the Alzheimer's disease. We hear a lot about heavy metals as well. And that's something very important we should be talking about. In phase 1, what we have a problem with removing toxins. They're being removed in the action in a process where free radicals originate. Glutathione is in operation there, where it combines with all those toxins like heavy metals. And in second phase, by combination of those particles to other particles that dissolve in water and are removed, again, glutathione is also involved in it, so it's our natural component. It's everywhere in living organisms. It removes free radicals. It's needed for them. Without, otherwise, it would burn our cells. We have various genes that produce proteins that cause better toxin removal, and CYP1A2 is one of such genes. You can test yourself. I found a prize for it even. It encodes proteins that are part of cytochrome P450 that are responsible for removing those toxins and cleansing the body through our gallbladder, our skin, our lungs, our kidneys. But this gene in half of us it causes, we metabolize caffeine very slowly, and we have such symptoms as increased heart rate, blood pressure increase, heart arrhythmia, headache, trembling hands, fear, anxieties, insomnia, irritability, digestional problems. If you have such symptoms, we know that we metabolize caffeine slowly, and it's like 4 times more slowly. And the other group of people, they metabolize and remove caffeine from the body 4 times faster. What do they have a lot of? Heavy metals, toxins, because they metabolize slower. So those who are fast metabolizers, then we have a lot of movement of free radicals. So both halves of people should support the toxin removal by using glutathione. And here are the variants, these alleles that like low activity of this gene through these variants lead to reduced toxin removal and higher risk of cancer of large intestine, bladder, lungs, larynx, breast, ovaries. So all those possible consequences are involved, as you can see. So here, if it's all somehow disturbed, this process of removing toxins, if it's better or worse, it's always the consequence of it has a consequence in all kinds of chronic diseases. CYP1B1, again, it's in the mitochondria. CC genotype people have higher activity, enzymatic activity, than the bearers of allele and more activation of toxic substances, more damage to free radicals and oxidative stress. So what we get, what we inherit sometimes, it's a worse metabolism and more need for glutathione. In the second phase of toxin removal are xenobiotics. There are particles that are soluble in water. Here we have encoding genes for glutathione S transferase. They play a very important role in toxin removal, and they bind free radicals. So this good glutathione is the reduced glutathione. And then we have GSTM1 gene, GSTT1 double deletion, people that can have poorer poorer capacity to remove environmental toxins and oxidative stress products. So again, we have a new story every time. Every new gene we discuss brings a new story. If you want to test your genes and you want to see what's up there, maybe your glutathione will be low for a long time, but they should be having high levels of glutathione, because you need to stop inflammation, inflammatory processes, cancerous processes that might be developing. GSTT1 it's significantly related to 4 times higher risk of hypertension. And my beloved gene that I always mention, MTHFR. These are mutations. I know many of you already know, because I told you to test this gene because it's a mutation. I started selecting those people. If you have heavy cardiological problems in your family, heart rates early in life, or strokes, or thrombosis, or thrombotic events, or thrombotic lung diseases, or venous diseases, depression, schizophrenia, neurological problems, autism. 98% of autistic children have the mutation of this gene. What does it do? It disturbs the metabolism of toxins. It's about toxin removal. methylation to be exact. If its methylation is disturbed, and 30% of us have this mutation, then homocysteine is increased, is elevated, the level. Well, maybe there are some supplements for it, but your gene is damaged. It all depends on whether it's damaged or not. Then you cannot, for instance, take B12, but perhaps you might have anemia with a high level of B12, and when they go together, you have like high B12 but anemia, then your blood cells are large, but there's anemia. There's shortage and deficit of B12, even though your level is much, much higher than anticipated, than normal. Then I always say this gene is responsible for that, because B12 that we have is not active. It's toxic then. You should not be taking it. And folic acid, the same. It's high because it's not methylized. If it's not methylized, then we just take it as a supplement, and doctors should not be given this supplement without testing this gene. And what does a gynecologist do during pregnancy? They always give folic acid, and 30% of women have this mutation, and there might be some damage to the fetus, there might be some miscarriages, and so on and so forth. So, but yes, good news is that it's good to check it, but like we can test it, and that's the good news. And heavy metals, Professor Lubiński was here. Actually, he elaborated this method of testing heavy metals, much cheaper. Not 700 zlotys, but 126 zlotys. You can test yourself on this website, readgene.com. Lead, cadmium, copper, zinc, selenium, and arsenic. These are the metals that you can test. In Medicus, for instance, with a good discount, you can really do it. So it's our good news to share with you. We're sharing good products with you, and we're also sharing this good discount for the test. And I see that people who start using glutathione, these levels drop in them. We have testimonies that confirm that. And this test, if you don't know whether you should be taking glutathione or not, you should test yourself. When we went to Croatia, there's a group from Hungary that was there. There's no testing, glutathione testing. It's forbidden. It's not available on the market. In Czech Republic and Slovakia, same. There's no testing for glutathione. And we are helping them to introduce it in their country. And this is another result of international cooperation at such conferences, that we can do stuff like that. So it's good to test yourself, because the total level should be within the norm. There'll be some examples probably soon, but it should this reduced according to current mitochondrial medicine. It should be 98%. After 3-4 months of good quality glutathione, all the levels go back to standard, to norms. Even if you're more than 40 years old and have problems with health problems. We have various expressions of genes, like GCS. It's something that speeds up the synthesis de novo of glutathione. It drops in the cerebellum, in the cortex, in other tissues. So genetically, this glutathione is reduced with age. But if we test women who are 100-year-old, this is all from PubMed, taken from articles, from medical articles from PubMed. So there's a paper on women with who are 100 years old. Do you know what their levels of glutathione were? Yes, they had good good genes and good levels of glutathione. This was shocking study. So for longevity, I have no doubt that glutathione is a must. Here, there's one drop, this oxidative stress with age, more than 80, but not everybody. We know that not everybody needs it, because those women that have this good level of glutathione, maybe I'll say that they can have such high levels until the end of life. Yes, so they might be taking glutathione, but it won't affect them because they have very good level of glutathione from the start. Yes, but there's 95% of people actually need it, and the diagnosis of deficits, like chronic fatigue, immunodeficiency, neurological problems, inflammation, chronic inflammation, problem with skin, digestion problems, problem with concentration. These all are signs of deficit in glutathione. So we should think about it. When, like diabetes, in cancer, neurodegenerative diseases, depression, infertility, lung diseases, specifically in lung diseases, and autoimmunology, this is when oxidative stress and free radicals are higher and its level. So we need higher levels of glutathione. And the strongest antioxidant is glutathione. It reduces free radicals, it removes toxins and pesticides, it removes heavy metals, and renews vitamins, vitamin C, and it repairs DNA. And you should remember that, right? If you talk to people, this is what glutathione does. When somebody asks you, there's like, I know what I'm saying is complicated, but these are the most important things. If you have some of these problems that I just discussed a moment ago, that's when you need glutathione. Sometimes people observe that these problems are reduced, and doctors say, well, what did you do? Well, I take glutathione. Glutathione can also remove copper, selenium, zinc, chromium, mercury, cadmium, arsenic, and arsenic, when it's high, 1.6, it gives you 30 times more risk of breast cancer. Jan Lubiński calculated it in his studies. But removing arsenic, if you don't say eat fish, cocoa, rice, in Poland it's high levels of arsenic in cocoa. In a follow-up study, those women that did not eat those things, they did have good levels of arsenic. 5% of them died, and those who ate everything, 50% died after 5 years with higher levels of arsenic. So it's so important to remove such simple elements as arsenic. This is a very important study for me. When I saw this study on the role of glutathione to prevent immunological COVID-19 thrombosis, a review, if you had a heavy COVID condition, severe condition, dying also sometimes. These heavy cases of COVID-19, these were people that they not only have diabetes, smoking, and hypertension, but thrombosis related to post-vaccination complications also, but also depletion of glutathione was one of the factors of risk, and it's one the most important mechanism in thrombosis. If you got glutathione intravenous injections, you were saved. I have paramedics, I know more paramedics, they kept saying, like, give me glutathione. I know that it's going to be good for them. I mean, it's not going to be that heavy, this condition in COVID. Now, and immunity. Glutathione increases the immune functions of the body. And there's a link between chronic lung inflammation, lung disease, with glutathione. And patients with cystic fibrosis or smokers should take glutathione because they have low levels of that. And glutathione levels that I've already mentioned, its role to and connection with thrombosis and yes, I need to speed up a little bit. I know we're running out of time. Yes. anyway, tests on patients with heart, myocardial infarction, and strokes. They get intravenous glutathione injections to remove a thrombosis before infarction, a myocardial infarction. They felt a lot of pressure, but we don't call an ambulance. It's not good if you don't do it for 30 minutes. It could be Lyme disease, it could be reflux, but sometimes patients that come to me with a heart attack, it's 14 hours later after the first symptoms. So it's not preventive glutathione intravenous injection anymore. But sometimes if you do it preventively, it's 60% less risk of heart attack. I just don't understand those things in medicine sometimes. Okay, we know it's related to inflammation markers with aggregation of platelets. It's also protective. Let's skip it. And what are the mechanisms here? Glutathione, like low levels of it, are related to pro-inflammatory states and conditions. Increased glutathione reduces inflammation conditions by reduction of IL-6 and TGF-beta, which was tested in HIV patients. So it's a standard procedure to provide glutathione to those patients. As for HIV tests, they tested it. They tested the precursor of N-acetylcysteine. It's a precursor of glutathione. It increases its level and the level of microglobulins. And they showed that these people have lower levels of gamma interferon, and it actually increases IFN gamma. I talk during breaks at conferences a lot of times that some activities that increase the level of interferon are so beneficial. And I said, I have tests on glutathione that it also increases gamma interferon. And increased glutathione also increased replication of reduced level of glutathione increases replication of all the viruses. There's loads of PubMed papers on that, and the effect of viruses, it grows when the levels of glutathione is lower. Even if you have some problem with osteoarthritis, it can be beneficial, like fatty liver or the inflammatory conditions, microinflammations, not necessarily viral CB, but like, for instance, fatty liver, non-alcoholic fatty liver, it's inflammation. I have test results here, and I see when people come to me and they have better enzymes. And in Croatia, they showed me they had better levels of liver enzymes and lower level of fat in liver after administration of glutathione. So I have people who are not using glutathione, but after detoxification, they were actually referred for transplantation. They had problems with horrible problems with the liver. Like, she had cirrhosis already, but she said that now she doesn't need it. She's regenerated. So, like I said, diabetes, again, inflammations, all those things. In diabetes, if somebody uses glutathione, there are new forms of glutathione. I focus on glutathione nowadays. So if you have diabetes, you should be watch your sugar level drops, because you need to actually give up medications very often, because sugar levels are reduced so strongly. And in Hashimoto disease, when all those hormones, you need to reduce them when you supplement glutathione. Sometimes it disappears completely. Obviously, gluten-free and milk-free diet, obviously, is a holistic approach. It's not just glutathione, but yes, the effects are huge. So I'm not going to repeat all that. I'm going to London again on Thursday. I have another meeting on glutathione there. And there was a lecture with Poles living in there, and there was a girl, like 10-year-old girl, and she said, like, my auntie is here, and she says, like, can I say something? Yes, I sat down. I had asthma, and I take steroids, inhalers, and my mom gave me a blue bottle with glutathione, 2.5 milliliters twice a day, and I don't have any medication. Half a year later, she came to Warsaw and she told the story in a large room as big as this one today. So I'm shocked when I meet such people. So, yeah. Another author of our, one of our colleagues had a similar situation. And memory impairment. I had a patient and who came to me from far away, and she says, I had Alzheimer's. And I say, like, what's your name? And she knows everything. She's well-oriented. We can actually compete intellectually. And she used glutathione for 3 months. When I'm shocked when I see somebody starts speaking after a stroke, and they hadn't been speaking for a year, for instance, after the stroke. So I'm shocked when I hear such stories. There was an accident. A doctor had an accident. And he never knew English, and after the accident he suddenly started speaking fluent English. But a few weeks later he stopped. It was weird. It's like, like a chip in your head. It was a Polish doctor. We have this evidence that it helps for Parkinson's disease. There are testimonies, but I also met a doctor in Spain. She was here. This is our second big event, actually third in Szczecin, and she came here to one of the first event, and she came and she said that she was in such a condition that she could not leave her bed. She had multiple sclerosis, and she received 5 milliliters of glutathione 3 times a day, and she started going to fitness, she started walking, she had personal trainings, she stopped having depression. Actually, that's amazing. We did a standing ovation for her. Some of you may remember her. It was shocking. I've told you, then amyotrophic lateral sclerosis, I hope it works. Studies show there's hope. Autism spectrum, yes, I can hear testimonies of children who start speaking, those who did not speak. Well, we need to say that they need to refer to a doctor, at least such a doctor as myself, to actually give consent for the application of this condition. And ADHD, I could never, I can always remember the visit of a boy who actually, he was very agitated. There's a huge change. He doesn't even need medication. Tuberculosis, also with Lyme disease. I had a patient. Well, you cannot help everybody. So, well, glutathione will not help everybody, but After 3 days, he returned. He says, I feel no pain. What is it? He had, due to Lyme disease, he has muscle and joint pain. The person could not leave the house, and then he says like, oh my God, she feels no pain at all. I cannot take her home from the garden. She keeps working in the garden all the time. So there's huge joy, this fulfillment in those people when they come back to health. A lot of positive emotion. And skin, I had hyperpigmentation. This was removed in myself. This was dealt with like in few weeks. Then I saw it work on acne, on psoriasis or I even saw vitiligo go away in a child during treatment. And then atopic dermatitis, alopecia. There was a 10-year-old girl in Warsaw, and the patient approached me, an acquaintance, and he says like, what is it? It's hair. And I had no hair in here. What do you do? I have glutathione. And he told me the story. How do you take it? I just take it under my tongue. And these are the stories. So my God, it's hard to believe it even. I didn't know this. Now, all cataract, all eye disease, sight diseases, sight-related diseases. I said, like, anybody has problems with sight? And there was an IT guy, and he says, like, yes, I have much better vision of the computer. It's hard for me to work so many hours with a computer, and I see much better than before. So we hear such stories. And then hearing loss, and then hypertension, regeneration of intestines. Now, with hypertension, if you take good glutathione, you need to be careful with medication. If your tension is 100/60, you should give up your medication, right? So hypertension is so simple to understand. There are receptors for toxins in arteries, and depending on the blood pressure that they sense, depending on what they actually sense, they are tense or less tense, or they got more relaxed. So this is so simple, but when you take something that removes toxins, then suddenly the pressure can disappear or can be reduced. It's not the only reason for hypertension, but if it's due to those toxins that are felt by the receptors, then you need to, then you can handle it with glutathione. And heart failure. There was a situation in Gdańsk that they were before the surgery, and then they say no surgery because the heart failure is gone, right? And the person took glutathione. So yes, with all the gratitude, that was my message. And now we'll move on to the next part, and Katarzyna Schmidt will be the next speaker.
No to jedno pytanie.
Okay, so one question actually. There was a question to slide.
Może dwa.
Maybe two questions. That's what we have time for.
Wszystko powiedziałem o glutationu?
Or have I said everything?
Nie chcę powiedzieć.
They don't want to speak up next to Stephen.
Przeciwwskazania do glutationu?
Counter indications for glutathione application?
Słyszałem, że po przeszczepach, że w stanach podawania chemioterapii, radioterapii. Jak jest chemioterapia, radioterapia, to jest efekt wywoływania śmierci komórek przez wolne rodniki. Jeżeli byśmy podawali glutation w tym stanie, to byśmy znosili działanie chemioterapii czy radioterapii. Jest to kompletnie niepotrzebne.
There may be some death of cells triggered by free radicals. Now, post-therapy or radiotherapy, all right, that would be my personal counterindication, actually, if I was to say any. Yes, there is a lot of research. Google autism plus glutathione, and yes, There'll be a lot of research actually.
Jeszcze raz?
Once again, could you please repeat?
Po chemioterapii, po radioterapii, 2
Post chemo and radiotherapy, I think 3 days. 3 days after you can
Brawa dla
actually
Marcina.
be administered that. Yes, let's give it up to Marcin once again.
Za każdym razem, jak go słucham, to mi się chce tego produktu.
Each time I listen to him, actually, I really want to get the product, get my hands on the product.